Kelly Hayes again from the University of Utah Burn Center. I'm going to be doing the second part of the elbow and shoulder stretching routine. You should see the other video if you want to see how to do these stretches when your family member or loved one is laying down. Oftentimes, if you have had a burn to any part of your armpit or your shoulder, your therapist will issue a set of pulleys that will hang over your door so that you are able to perform these exercises at home. I'm going to place these in my patient's hands, and I'm going to instruct you to go ahead and use that pulley to completely straighten your injured arm. Your loved one may not be able to get right to this right away and might have to work for a couple of minutes before being able to get the arm completely straight. So they might start off closer to something like this, and then each time they stretch, increasing the range of motion that they are working towards. Generally, we have a patient perform this for 5 to 10 minutes so that they are able to get a good stretch. We work in this direction, but we can also work going side to side. So arms, pointing out like this and working all the way up. Go ahead and pull it down over there so that the arm is in its complete range of motion. Something to watch out for is that you or your family or your loved one is not leaning side to side to compensate for shoulder movement. You want to make sure that you are isolating just at the shoulder and not using another body part to get away from the stretch, so to say. So you may need to watch your family or loved one to make sure they're not doing that. So here. While sitting up, you can also perform some stretches with your elbow. If I am helping my family member or loved one, what I would do is I would place one hand either directly under the elbow joint or just slightly above it, depending on their level of pain tolerance. I would use my other hand to hold their hand or at their forearm to gently bend their elbow to their point of tolerance, and then holding it there and progressing each time you do the stretch. You also want to make sure that your loved one is able to get their arm completely straight, which means supporting in the same locations and applying pressure in the opposite direction to ensure complete elbow extension. If you are doing this to yourself, it's a little harder to get that full range. I do recommend that you do have someone help you with this if you are having a hard time getting your elbow completely straight. Another part of your elbow is making sure that we are able to what we call supinate at the forearms, or being able to turn our hands over. How this looks is that you want to make sure that your elbow is bent at your side, and I hold the person's hand like I'm shaking their hand, and then I slowly turn the hand over like they're holding a plate and holding this stretch here. What you don't want to do is have their arm out like this and then turn it over, because what's happening is that they're actually rotating at the shoulder and not isolating at the forearm. So again, that looks like here, turning over here. A great way to add strength to this exercise is holding on to like a soup can or even a hammer, holding on to that and rotating as you're doing this. A common mistake I see patients sometimes do with this is that as we're rotating, they bring their elbow in like this. Again, make sure that you are isolating here and stretching just at the forearm. That's all I have when it comes to stretching the elbow and the shoulder at this time. If you have further questions, please don't hesitate to give our burn therapist a call. Our therapy office number is 801-581-2132. Thanks.